Hi, I'm Rob. I'm a registered physiotherapist here at PhysioWorks. Today we're going to talk about a little bit about anatomy and your back pain. So mainly we're going to focus on your spine and your disc. So this is your spine. This is the back of it. These are all the little bumps that you feel on your spine. You have what we call your lumbar curve, your thoracic, and your cervical, your neck. The lumbar curve is made up of 5 individual vertebrae. You have your 5, 4, 3, 2, 1, your 5 lumbar vertebrae. You'll often hear physicians and chiropractors or physios talking about L1, L2, L3, L4, L5. That just indicates what level we're talking about. So your 5th lumbar, your L5, your 4th, L4. So the structure we're going to focus on is our disc. Our discs are these individual structures that are located between every level of your vertebrae. So you have your disc in between your L4 and your L5. So your disc is like what I simply call it an industrial strength jelly donut. Industrial strength jelly donut. So it has this really tough fibrous outer ring. It's thick, it's strong, but it still allows us some mobility. On the inside is a jelly-like softer material that gives us our mobility, a little bit of shock absorption. So when we talk about a disc herniation, a disc bulge, disc protrusion, this is what we're talking about. We're talking about the inner nucleus of this jelly-like material when it bulges out and starts to protrude outside this outer ring. And how does that happen? It happens mostly under flexion or a front bending load. So here are your 2 bony parts of your spine, and we'll call this L4, and we'll say this is L5. So these are the back, the bony prominences. This is the front of your spine. If I take this spine and flex or fully bend forward, you have this compressive force at the front of the spine. So over here. So if you envision, if I took a jelly donut and I just started to squeeze the front of it, this jelly, the nucleus will start to migrate towards the back. And that's what we call a disc protrusion or herniation. Herniation is when you actually get a full protrusion of this material on the inside. And those are the severe cases. So you can get a high force bending and lifting, large compressive forces in the front, jelly migrates backwards. Even to a point, prolonged sitting. Those of us who say, oh, I sit for a long time and my back starts to hurt. Same thing. Sitting is a prolonged but small forward flexion or bent position. So if you're sitting for a prolonged period, even that subtle pressure will slowly start to push your disc, the jelly in the inside, posteriorly out through the back. That's just as a problematic position as a lifting a bit high load force. So the other anatomical feature of the spine that we should be worried about is your nerves. Okay, those of us who have back pain know what we call sciatic pain. Sciatic pain is when the nerve coming from your lumbar vertebrae starts to get irritated, and we can get those referral pains down the leg. They can go as far as your toes or even just in your butt. You can get numbness, pins and needles, tingling, pain, or even weakness. Now, why is that important with the discs? At this point here, this red structure here, that's a bulge, that's a herniation of your disc. Right beside it, the yellow, those are our nerve roots. So at every level of our spine, we have nerves exiting that make up our big sciatic nerve or other major nerves in our body. So if you have a disc that's protruding far enough, or even if there's an irritation or inflammation of that area, it will easily affect this nerve root. And once this nerve root is involved, that's when you get the sciatic pain. So sciatic pain is not just about the nerve, it's often fundamentally coming from your back. And that's why you should have a comprehensive assessment from a physiotherapist or another healthcare professional.